It is now March 14th, Thursday at Deuk Spine Institute. Our patient travels here with a herniated disc in his neck, C6-C7. That herniation is more on the right side. He's having neck pain, cervicogenic headaches, cervical brachial syndrome, and arm symptoms with radiculopathy. Other surgeons would recommend a fusion or artificial disc. This patient didn't want a fusion or artificial disc. He wanted less invasive surgery. So he came to Deuk Spine for the Deuk laser disc repair. We're going to go in there and fix this disc. It's number 6-7. He is asleep. He's intubated. He has a tube down. And I'm going to go through the front of his neck. I always go on the side opposite of the worst arm symptom. Shut. All right, you can see the needle is at 2, 3, 4, 5, 6. We need to be further south. How is he in terms of relaxation? Yeah, because I feel like I'm struggling a little bit. So when we do these surgeries, the main reason I put patients to sleep with a tube under general anesthesia is so that I can do what's called chemical paralysis. We want all their muscles relaxed. Otherwise, if you push on somebody's throat, they have a reflex where they tighten up their muscles, and I can't feel the spine. So to improve safety and improve the ability to do the surgery, I give a muscle relaxer so all these muscles are loose and relaxed, and I can get to the spine easily. Okay? Henry, let's show our audience, why do herniated discs in the neck cause so much pain in the neck? Tell me when I can proceed. All right, yeah, much better. At this point, we're going to place our needle shot at C6-7, shot, 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 AP. Just need a moment to do this. Quick shot, quick shot. All right, let's see. It's hard to see. Shot. I'm going to try to position a little more medial. Shot. Lateral. That's in the middle. That's where we want to be. Quick shot. All right. Shot. 2, 3, 4, 5, 6, 7. Shot. Everyone agree we're at 6-7? Boy, that's a workout for my fingers. Shot. All right, let's get another AP. 2, 3, 4, 5, 6, 7. Coker. At this point, we're trying to place the needle. This is the hardest part of the entire surgery. It has to be done perfectly, and there it is, right in the middle. Perfect. Now, some patients have thicker necks with lots of muscles. This patient is that patient, which makes the surgery harder, but we still get it done. We're going to go into the disc at 6-7. We're going to do a discogram. I need a little bit of a shoulder pull I'll do all this, if you can get the shoulders. I don't need you to do anything, Dr. B, unless his head is not midline. But we're going to do a discogram shot. This is not a evocative discogram. This is what we call shot, a chromodiscogram. Shot. All right, let me do a little bit more. Shot. Perfect. Look at that. Okay. Let me just, here, hold this right where it is. I'm going to do one shoulder pull. Shot. The other one was better. But anyway, you can see the tear in the back of the disc. Take. Num. At this point, we are inside the C6-C7 disc. And I'm placing my guide wire. Shot. Shot. And when I take a shot, yeah, nice job, Louis. Shot. There's the guide wire. I'm actually looking to see where we are. We use the X-ray machine shot to guide the surgery. He has a very muscular neck. I don't know if you guys can appreciate that. All right. Any questions?
Yes, we have a question from Eljai on Facebook.
Hello there.
And they ask, hello, I would like to ask if a patient with multi-level congenital cervical spine stenosis and foraminal stenosis due to bulging disc arthritis would benefit from this procedure?
Yes, this is the perfect surgery for anybody with a bulging disc, a degenerated disc, stenosis, arthritis, neck pain, shoulder pain from the neck, any of those things. Ruptured disc, bulging disc, extruded disc, protruded disc, slipped disc. Any problem with your disc, this is the surgery you want. This is the least invasive surgery in the world. Everyone else is still doing fusions and artificial discs. But this is much better and safer. And there's no metal. This is arthroscopic surgery. All right, we have our guide wire. We're now going through the 4-millimeter incision. The whole surgery is done through one little tiny cut. Shot. As you do this, you have to be really careful to control the guide wire and the dilator at the same time. You don't want to advance the guide wire by accidentally pinching it with the dilator. All right, this is the only blood we're losing the whole surgery. You see this? Every other surgery done, ACDF, cervical fusion, anterior cervical discectomy infusion, artificial disc, laminectomy, much more blood loss. You can lose liters of blood if the surgeon is not careful. AP? But with this surgery, it's only a few drops. So this is basically bloodless surgery if there is such a thing. All right, the tip of the dilator is in the middle. You can see that. It's perfect. I'm very happy with that. At this point, I'm going to advance the dilator just a little bit into the annulus. Now, I'm not making any holes. I'm pushing the fibers apart. What does that mean? When you put a pin, a safety pin in your clothing, does it cut a hole in your clothing? No. It just separates the fibers. We're going to go to the back of the disc. I can already feel the narrowing. I'm going to bring my tube inside. Next. Just want to get this a little bit further. Perfect. Now, the entire surgery will be done through this tube. You guys see this?
Yes, we do.
If we were doing ACDF, marking pin, the incision would be like this. Okay? And you wonder why people have trouble swallowing after the ACDF. I've done 1,000 ACDF in my career. Okay, this endoscopic surgery on the neck, I've done about 700. This is a much better surgery. You don't want ACDF. You don't want a metal plate. You don't want metal, plastic, cadaver bone in your neck. This is the best in the world right now. All right, Henry, let's show the audience how this surgery works. No, relax. Shut. Welcome back.
I don't know. Can I have another walking stick, please?
No, we're okay. We're okay.
Sure.
Yep. Let me just see what I got. All right. You now see what the laser surgery actually does. We're going in through the disc to the back where the problem is. The problem is the annular tear. The annular tear is a tear in the wall or annulus of the disc. You can get it out just if you want to, but you don't have to. All right?
It's a standby.
All right. Perfect. So here's our laser fiber. You all see the laser fiber?
Yes, we do.
That piece of glass, that glass fiber is point 0.5, half of a millimeter wide. And you saw how it moved backwards. The reason it moved backwards is shock wave. When the laser emits its energy here, it keeps going backwards. I wonder, can I get a Raytech here? It'll help stop it from moving backwards. Let's wrap it up there. When the laser emits the energy pulse of energy here at the tip of the glass fiber, this is really a fiber optic cable.
With the water should be.
And yeah, and so fiber optic cables, folks, they transmit electromagnetic radiation, okay? And that's what laser is. Laser generates electromagnetic radiation, which is many different forms of electromagnetic radiation. But one of them is laser energy. There's light energy, there's microwaves, there's radio waves, there's infrared. Ooh, big herniation there. Look at that. Oh yeah, oh yeah. There it is. That's a big piece of herniation. It just popped into the tube from the side. It was under a lot of pressure. Now I'm going to try to grab it out. I don't know if I can. It may be scarred. Because what happens is when you get the tear and the herniation, you get a inflammation, an inflammatory response by the body within the annular tear, and that inflammation over time causes scar tissue. And that scar tissue sticks the herniation to the annular tear. So it makes the whole situation worse instead of making it better. Your inflammatory system is there to remove the herniation, but it can't because it's too big and it just can't get rid of it. The real reason is because the herniation is not cellular. You see, the inflammatory system is designed to attack bacteria, fungi, and viruses, cells. Viruses are not cells, but the cells that contain viruses are cells. So it's quite fascinating. Your inflammatory system is attacking the herniation, but the herniation is not cellular. It's made from proteoglycan and glycosaminoglycans, GAGs. These are basically molecules made from sugars, proteins, hyaluronic acid, is a complex carbohydrate that's long chain with an acid side chain at the end. Anyway, how do I know this stuff? Because I'm a biochemist, and it's a biochemical molecule. And so my entire college, undergraduate, I majored in biochemistry, cell biology, and double majored in chemistry. So these are all chemical compounds, and I'm very familiar with understanding them, but most people don't understand them because they're not exposed to these things in college. But for me, it's simple. They're basically long chains of carbon and hydrogen with a acid group at the end, okay? And the inflammatory system is attacking, trying to get rid of it. It wants to remove this proteoglycans, GAGs, but the inflammatory system is supposed to be attacking cells. So the inflammatory system is highly effective at killing cells like bacteria, okay? But it's not effective at removing hyaluronic acid. So we bring the laser, and the laser does it for us. Actually does it for the patient. Any questions?
Yes, we have about 3 questions so far. This next one comes from Tom on YouTube.
All right, Tom, we'll take your question. There's a bone spur right there, by the way. People, can we turn the light down one click? That's a bone spur I just took away. So that looks good. Yeah. Bone spurs. Just before we take Tom's question, bone spurs are very common, associated with disc injuries, facet injuries, joint injuries, hip injury, knee injury, shoulder injury, whatever. Bone spurs are your body's reaction to the injury, and it's a way your body is trying to stabilize the joint, the injured joint. So it forms bone spurs around the joint. Basically calcium deposits. Anyway, the point is, you don't need to remove bone spurs unless they're causing symptoms. Otherwise, we leave them alone. You're never going to remove all the bone spurs in the human body. There's always going to be bone spurs. I have bone spurs, but I have no symptoms. So the goal of treatment is to eliminate symptoms and signs, not remove bone spurs, okay? So that's not my goal, to remove bone spurs. My goal is to get this patient out of pain, and improve their neurological function, and that's what we're going to do with surgery. All right, but sometimes you need to remove a bone spur because it's causing symptoms, or it's in the way, like this one right here. So I'm removing it. All right, we'll take the question.
Question from Tom on YouTube asking, hello, my MRI review is with you tomorrow. If that goes well, how far am I out from surgery? I'm in extreme pain and don't know how to get through it.
Tom, I wish I could do your surgery today. The reality is I don't know how far out my surgery schedule is. I don't do the scheduling. We have a team that does that. And that team will reach out to you right after our meeting tomorrow, and they will talk to you about scheduling. And so just wait till tomorrow, and when we're on our telemedicine call on Zoom, just mention you would like to be treated immediately, and that way the team members can hear you say that, and you can ask how far out we're scheduling, and I'll see if we can't get an answer, okay? But we are, as you can imagine, very busy because people are learning about this procedure and how it's curative, and they want it. They don't want fusions. They don't want to live in pain. They don't want pills. They don't want therapy that doesn't work. They want to be fixed, and I want to fix them. So that's what we're here for. And I'm sorry you're suffering. I really am. I wish I could stop your suffering right now. So yes, I would say, to be honest with you, if you're highly motivated and prepared to travel, you could get your surgery done next week, okay? That's the God's honest truth. Anybody that's really suffering, I will not allow you to suffer like that, and I will force my team to reach out to you sooner and get you on the schedule sooner, okay? But I need to look at your MRI and I need to interview you and do an exam because I don't know what's wrong with you, and I don't know, you know, how we have to fix it. But whatever it is, we can fix it as long as it's degenerative, okay? That's what we do, degenerative stuff. All right, look at all this scar tissue. This is from the herniation. Tremendous amount. See the gold color, the reddish gold? That's calcium. It's called dystrophic calcification. And that's sitting right on the nerve, literally on the nerve. The nerve is right down there. That's the nerve root, number 7, okay? C7 nerve root. It goes to the triceps and brachioradialis, and it's getting crushed by this inflammation and pressure. All right, I'm going to flip and go the other way. I'm going to go side to side. We always treat side to side. Here's the other side. Here's a bone spur. Now, that's a bone spur I have to remove. So people ask me, can you remove bone spurs with the laser? Absolutely. We can. The laser can melt steel. So if this laser can melt steel, you better believe it can cut bone spurs out. And normally I don't take bone spurs out because it's unnecessary. It's not helping the patient. And it can cause more inflammation and more bleeding. But I will take the bone spur out 5 minutes, Dr. Berndes. I will take the bone spur out if I need to. If it will help the patient, I will take it out. Okay? The reality is it doesn't help the patient most of the time. So I leave them. It makes the patient worse. All right. Any more questions? I'm sure you do.
Yes, we have another question from LG. Excuse me if I'm mispronouncing that name. Once more on Facebook,
Hello?
asking follow-up question: would laser surgery take out the extra growth of the bones that compresses the spinal cord and spinal nerves? Also, cervical stenosis usually from a narrow space of spinal canal from the bone itself. Would the patient be safe to extend the neck after the procedure and participate to sports?
Yes. So this surgery is the best when it comes to sports, when it comes to recovery. The problem with the other surgeries, they're going to put metal in your neck, which is going to limit your movement no matter what they tell you. It always does. And you're able to go back to normal activities after this surgery. Not right away. You have to wait for a year before you go to contact sports. But generally speaking, you can go back to normal activities after the surgery, including sports, work, whatever it is you do. But you just have to give it time to heal first, okay? And there's no way to speed up the healing. It takes 1 year to fully heal. 1 year. And I can't speed up the healing. All right. This is going very well. 5 minutes indeed. This is all, the blue stuff is all the herniation. And it's so scarred down. The reason it's scarred is inflammation. This patient's body is attacking the herniation, trying to get rid of it. And of course it cannot. So what does it do? It attacks, it attacks, it attacks. And the result is bone spurs, scar tissue, calcification. More pain. And what we're doing is we're basically helping his body heal naturally. His body wants to remove the herniation just like the laser's doing, and I'm doing it for him. His body is unable to do this because it's not able to remove the herniation. Everybody thinks herniations go away on their own. They don't. They never do. They get better symptom-wise, but they never go away. Yeah. And they end up getting worse in time. The only way to make that go away is to do what we're doing here, to use the laser to clean the herniation out. Or you do metal and you do a fusion. That will make it go away as well. All right. Any other questions?
Yes, we have a question from Simo134 on YouTube
Yes, Simo. 3 minutes.
asking, "Hi, Dr. Duke. Since you have trained in South Korea, I have to ask, do you eat kimchi now?"
That's so funny. I do, but not for that reason. I eat kimchi because number one, my wife is Korean, South Korean. And we've been married for 20, oh God, how many years now? I know she's not listening, so I'm safe, but we've been married for, oh man, I got married in 2002. So what is that, 22 years now? So I've been eating kimchi for more than, actually for 22 years. I was trained in South Korea and Germany and the United States. And that was 18 years ago this June. Actually, about 18 years ago next month. Yeah, May. So I've been eating kimchi though for 22 years because my wife is South Korean. And my mother-in-law makes kimchi at home. And all kinds of Korean food, which I love, by the way. But I like all kinds of food. My favorite is either Persian or Indian, Mexican, but I do like Korean. I do like Korean. I like food, Indian food. I like food from all over the world. Food that's flavorful. I don't like boring food. American food is boring. I don't like American food. Boring. I like food with flavor and spice. So, my favorite Persian dish is gourmet zabzi. Gourmet zabzi. Oh, my favorite. And there's nothing like that here in Orlando. There's no good Persian restaurant. Now, I come from LA, Los Angeles, and there's very good Persian food. I was just thinking about it the other day. I got to admit, I've told this story before, and I'll tell you again. 1 minute. My wife is the one who got me into doing these surgeries because the opportunity came up to learn, and somebody offered it to me, and I laughed at them. And I said, in my arrogance and ignorance at the time, but truly a moment of weakness, I said, I trained at the #1 neurosurgery training program in the world, which I did. University of Florida in Gainesville. And we didn't do this stuff. No endoscopic garbage. And so we did fusions, laminectomies, discectomies, artificial disc, everything else that most doctors do today. And we even did NIH-funded research on spinal cord injuries with Dr. Fessler in his lab. I mean, we did so much. Point is, I laughed at it and I said, no, I'm not interested. Told my wife about it, and she said, go. It can't hurt to learn something new. I said, I don't want to waste my time. Let me get this one piece. And she said, just go. You never know what you're going to learn. She was right, and here I am, now doing these surgeries. So, it just shows you in life, never turn away an opportunity to learn something new. You never know what you're going to learn. Maybe you don't adopt a technique or whatever it is. Maybe you never do, but you can always learn something, you know, irrigation. You can always learn something from every experience. And I think that's the key point. We're done.
Sitting on, please. Thank you.
And, you know, it went well. He does have some very bad, severe inflammation in that area from many, many years of injury. But I think he's going to be very happy with the results. Any more questions?
No current questions, but we do have a comment from Arida on Facebook.
All right.
saying, I have been saving all of your videos and watching later, and some of them rewatch. Your team, exceptional and amazing. Beautiful work to watch, knowing how dangerous it is. Blessings a lot for everyone in your life. Thank you.
Thank you very much. We appreciate it. My team loves to get great feedback. You know, we came up with the idea of broadcasting 10 years ago, actually 11 years ago. And it's born out of my love for teaching. I like to teach people things. So I've been teaching for many years since college. I taught physics, chemistry as a teaching assistant and as a tutor. And then in medical school, I taught, medicine to my fellow students that were struggling. And of course, in residency, I taught neurosurgery to the junior residents. But the point is, I love teaching, and what I learned is that if you want to learn how to do surgery, you got to be in the operating room. You got to be watching. There's the incision, 4 millimeters. You guys see that? 4 millimeters.
Yes, we do.
And we lost maybe 10 drops of blood. 10 drops. There's no metal, no metal plate, no screws, no cadaver bone, no cage, nothing. Natural. We went in and we helped his disc heal itself. That's the whole point of this surgery. It's called Deuk laser disc repair. If you have a herniated disc, bulging disc, ruptured disc, protruding disc, extruding disc, degenerated disc, spondylitic disc, stenosis, radiculopathy, neck pain, cervicogenic headaches, whatever, anything with neck pain, we can fix it at Deuk Spine Institute. It's either going to be the disc or it's going to be the facet joints. And the disc is the cause 85%. The facet joint is the cause 15%. So we have treatments for both. If it's the disc, it's the surgery you just watched, Deuk laser disc repair. If it's the facet joint causing the pain, it's the Deuk plasma rhizotomy, which we just patented. And both are FDA approved, and they're the most effective treatment in the world for pain. Hope you enjoyed. And the next surgery is going to be rhizotomy. The patient does not want to broadcast. He wants privacy, no broadcasting. So we won't broadcast the next one, but we'll broadcast the one after that. What is the one after, Henry? Do you know?
I know that we have 2 lumbars. One's a bilateral and one's the other is a 2-level.
All right, so it'll be a lumbar Deuk laser disc repair for back pain and a herniated disc. That'll be our next broadcast in about 45 minutes, so come back then. Nice having you all here. Thank you. With one of our videos.
Copy that.
Good morning, I'm Dr. Deuk Majan. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4 millimeters, because you had 2 discs that needed to be fixed, so were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct. I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
Within
was
an
nice.
hour. Yeah, that was nice to be able to recover at home.
Yeah,
Not have to go to the hospital.
correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day.